about. So if you're either someone who thinks they've just ruptured their Achilles, or you're a paramedic or a medical person who would like to learn more about Achilles injuries, or more specifically a ruptured Achilles tendon, this is exactly what we're going to do. So we're going to be talking about what it is, how are you going to diagnose it, or how are you going to know if it has happened, and then we're going to talk about treatment. So we're going to talk about like different kinds of boots or slabs, and then like kind of the long-term process. And then I will be making a series of videos, probably like once every week or two, to then update you with my like specific process or progress, more like, so like physio, or like what am I doing with the boot, or what, like, am I weight bearing, am I not weight bearing, am I surgery, no surgery? So that's kind of the gist of it. So what exactly is a ruptured Achilles tendon? So it's pretty much when the Achilles completely breaks or ruptures. This is normally when you're putting maximum force on the Achilles. What I've also read is that it's normally when your leg is like straight out and you're pushing with maximum force, which puts the most tension on the Achilles. And then you hear a snap sound, or the people around you hear a snap sound, and the person falls over. And normally there is a feeling like you've been kicked in the back of the leg, which is exactly what happened to me. Once that happens, you will then notice that there's pretty severe pain. I probably had like a 7, 8 out of 10, which slowly just turned into like dull numbness of the leg. I wasn't able to really like flex my foot, so I couldn't push down on my toes against the floor or against anything, because I had lost all that power, because that's exactly what your Achilles does. When you do like a calf raise, that's exactly what your Achilles is doing. So if you think that your Achilles is snapped, or you think someone's Achilles is snapped, if you put your fingers or you put their foot on the floor and tell them to try and do a calf raise with that foot, they won't be able to. I was still able to walk with my Achilles being ruptured, but I didn't have any power in my foot. So my right foot, which is the normal foot without the rupture, I had to then balance myself on my right foot. And then my left foot, I kind of, which they call the zombie walk, where you turn your foot to the left, so my left foot I turn to the left, and then I'm able to walk with my foot sideways, because then I have more control over it. So that's pretty much what the rupture is. How do you know if you've had a rupture? So generally the literature that I did read is like, if you think you've ruptured your Achilles, you probably have. It seems to be like that's pretty accurate. The other thing is that if you feel for your Achilles where it should be, from your heel down your Achilles, you will feel like there's a gap. Like there's just, if there should be your Achilles tendon, and then it's not. If you feel on your normal foot, or the foot that doesn't have the injury, if you feel the differences, you'll feel just like a big gap, it kind of goes flat, and then there's a bump down, and then if you continue, you'll have a bump up, and that's a pretty good indicator. Then there's also something called a Thompson test, which you'll probably see on the internet too, where the patient will either lie prone or on their stomach, or they will kneel on a chair, and then a medical practitioner will then squeeze the calf of the patient who has on the leg that has the tendon that has no damage to it, and you'll see that the foot moves when you squeeze the calf muscles, because all of those muscles will, because your calf is attached to your tendon, which is attached to your foot, will then cause the foot to move. If you then do it on the foot that has the suspected rupture and there is no movement, then you probably also have a rupture, because if you squeeze that muscle and there's no movement, then there's possible. It is also important to notice that this test is not bulletproof. So what they're saying is that it is very sensitive, but not necessarily specific. So if you squeeze and it doesn't move, your foot or your Achilles is probably broken. But if you squeeze it and your foot does move, it doesn't mean it's. I always thought that you had to either go with surgery, because you've broken your your Achilles. It is the biggest tendon in the body, and so if it's broken, surely you need to have surgery. The more research I've done is actually there's a non-surgical route, or non-invasive, or non-operative route, whatever you call it. And now the literature is actually saying that at 8 months, there is no difference in terms of whether you go surgical or non-surgical route. That's really interesting. With surgery, there's more complications, like there's wound healing issues, there's surgical risk complication. You have to go under general anesthetics, which also means that there's other risks in terms of that. And pretty much what they're saying is that unless you derive your income from having your Achilles, so if you're like an athlete, or you do something where you need like massive strength or normal strength in your Achilles as soon as possible, you can go surgery, because that will give you strength quicker. But there are possible complications with that. But if you're not, an athlete, or you're not trying to derive your income because you have feet, then just going the non-operative route is actually fine for most people. I was given the option for surgical or non-surgical. I said to the surgeon, I'm okay with non-surgical. And he's like, you made the right decision. You need to make up your own mind. Every case, every situation is different. It seems like America seems to push a lot on surgery. I'm not exactly sure why, but the rest of the world is pushing more and more on non-surgical because it's cheaper. And at the 8-month mark, it is equivalent to. The re-rupture rates are also the same for surgical and non-surgical. So what is the immediate treatment for a ruptured Achilles tendon? So what you want to do is you want to put the foot into a extended position or a ballerina position. There's a couple of names for it, but as long as the toes are pointing straight down. Why are we wanting to make the toes point straight down or into a ballerina position where the toes go straight, the foot goes straight? Is that what that does is it shortens the length the tendon needs to grow. They recommend that if you don't seek help or if you don't go to a doctor or a medical practitioner within the first 2 days and put your foot into I think it's like equinus, or I'll put the word at the bottom. What happens is that then that actually damages the healing process, because the way a tendon heals is that the blood all seeps in and then that scar tissue then becomes the tendon. And so if you don't narrow the gap between the tendon and where it's broken. So if the two pieces are broken and now they come apart and you put the foot into the like ballerina position, it then pushes the tendons closer, which then causes better healing potential. If you don't put your foot into that position within the first, they say like 24 to 48 hours, then you're probably going to need surgery. So the best thing you can do if you've just come off like whatever you're doing, basketball or squash or hockey or whatever game you're playing or whatever you're doing, and your Achilles tendon broke now, the best thing you can do is put your foot into this toes down ballerina position and go to the A&E or to a hospital where you're going to see medical help. What that means is that as soon as you put it in that position and you leave it in that position, your body has the best chance to heal back normally. This also is that if you leave your foot flat at a 90-degree angle, the tendon will be far away, which also means that if it does heal, it will then heal long, which then means you'll lose more and more power in that foot. So as soon as you put it like this, the tendon goes closest, and then once it's healed, then you're going to slowly bring the foot to 90 degrees over like a period of weeks, which then will then allow the tendon to be properly healed, and then you need to grow muscle and strength and flexibility. So that's exactly what happened to me. So within like 6 hours, I was in a hospital. They put a plaster of Paris slab on the front of my foot, which then meant that my foot couldn't go out of that pointy toe ballerina position. And after a week, I then saw a surgeon. We had the conversation with the surgeon. The surgeon said, do you want to go surgical or non-surgical? And I said, I think that non-surgical is fine. He said he agrees. And he then gave me a Vacoped boot. This is a special boot for these kinds of injuries. You pretty much set it, or the doctor or surgeon will set it to whatever they're wanting. Normally what it does is that it then allows you to put weight on the foot, and it keeps your foot at a 30-degree angle, which is pretty much exactly what you're wanting. The benefit of the boot is that you're actually able to walk on the foot because the pressure lands on your shin, and then it actually allows you to walk. There's a lot of conversation about, do we do early weight bearing or do we not do weight bearing? I spoke with the surgeon, and the surgeon's like, if you are able to put weight on the foot, then put weight on the foot. If it's too sore or if it's too uncomfortable, then don't do it. So it's just like, listen to your body. I found that really helpful. There are a lot of different protocols. There's lots of different opinions. Some people like, put your foot up for 6 weeks, don't weight bear. There are some people who do all sorts of things in different ways, and all of the literature that I've looked at and stuff like that is that they're saying that the earlier you can put weight on it, the better, because that also keeps all the muscles. The two biggest concerns with this kind of injury is that either your tendon heals long, in which case you're going to have surgery to shorten it, which means you're then straight back to point zero because you have to start again, or you actually lose all the muscles in the leg because you're not walking on it, you're not using your calf muscles, you're not using all the muscles surrounding your leg, you lose all that strength. So there is a lot of conversation about keeping the muscle strength with physio, with doing whatever exercises you can do to maintain the strength of the leg while you get the Achilles. That's pretty much the gist of what a Achilles tendon rupture is. I will make another video about the actual like protocol. So like at what point should we be doing what? There's multiple different opinions. You know, some say we should be adjusting the boot at 2 weeks, some say 3 weeks, some say 4 weeks. You know, some say at week 8 you should be in normal shoes. Some say by week 6 you should be in normal shoes. So there's different kind of variations in terms of what guidelines and protocols are saying. But that'll be in the next video about how to use the Vacoped boot, how to physically use it, and then also how to adjust it, and then when and how to adjust it if you don't have anyone telling you how to do this. This is purely the stuff that I've read online. Guys, if you did find this useful, please hit like and subscribe, and yeah, we'll see you in the next video. Bye for now.